Hi everyone, I've just realised that we are muted, which is such a shame. What a real shame that everything was muted then when I was talking. Apologies, I will go back to the start. So, welcome everyone to the DClinPsy Interviews Talk for 2023 at Clinical Psychology Community UK. My name is Holly and I'm really grateful for you joining me this evening. Apologies for all the technical issues. We started a little bit late as well. I really do apologise. It's been a little while since we've gone live. But you're very welcome to join us here today on the YouTube channel. You found us. Make sure you hit the bell and subscribe as well, and you'll get notified of all the new videos. And we're also really active on the Instagram page at Clinical Psychology Community UK, where we do a monthly Q&A, and we also do a weekly diary of everything that happens on training. And also plenty of things on the page as well around. This is lots of different videos on how I prepared for my successful DClin interview. Lots of vlog type things that I'm doing at the moment. So there's one there on a second year study day. And also I've done a week in the life of a first year trainee. So there's plenty of insights there on training. And we also try and do a few extra little wider things on psychology, like working in multidisciplinary teams or how clinical psychology functions in the UK. So now today, what we're going to be talking about, we're going to be going through a couple of disclaimers around what we're going to talk about. There are some caveats to what I'm going to say, so it's important that you're aware of them. We are going to talk about some basic interview information, what they are, how they happen, what they look like, that sort of stuff. We're also going to talk through in detail some preparations that you can do for your interview, as well as talking about what to do during the interview and the sorts of things you might expect and any additional tasks. So kind of video tasks or role plays that you might get as well. So we're going to talk through some of that. And then we're going to think about what you can do after the interview, because that is also a really important part of this and how to manage that. So that's hopefully that will be helpful. And then we're going to have a Q&A section. So if anyone does have any questions as we go through, I will try my best to keep an eye on the chat, but I'm not going to be very good at doing that today. So hopefully I will get through to them when we get to our Q&A section. So any questions you've got, let me know. Let's get started then. So, disclaimers. These are really important because each course is different and they value different experiences in candidates. They might want leadership, they might want research, they might want therapy training, they might want loads of different things. And my advice is quite a general lot of advice, and there will need some tailoring to the different courses. And this kind of a follow-up, do what feels right for you. You know, don't follow this advice if it feels like it wouldn't be helpful for you. That's okay. I really trust you to follow your intuition and your instincts. So don't follow this advice if you feel that it is not going to be helpful for you. You'll already have lots of ways of managing this stuff. So, you know, you've all gone through interviews before. You all know what helps and what doesn't. So I'm just here to help give you a few suggestions that might work. So also, just to kind of give you a little bit of background, I've applied 6 times. I had 3 years of applying without any interviews. I have interviewed 4 times for 3 different courses. And that means that I have not interviewed for like 30 courses that I have not interviewed for. So there's a lot of experience that I don't have. So it may be that you have an interview coming up or you're hoping to interview for a course that I don't know a lot about. So that's what I mean in terms of you will need to do a bit of research on what the course likes and try and apply some of these general tips to that. And also really important ones, so please don't ask because I won't be able to. I won't be disclosing any actual interview questions, but we are going to go through some themes. And the reason for that is courses generally ask us not to, because it gives an unfair advantage to people, really. If you happen to follow this YouTube channel, then you'll have an advantage over someone that doesn't, for example. So that's not always fair. So I won't actually be disclosing any questions. Apologies. But yeah, I'm going to give you quite a lot of detail about the themes, so don't worry too much. Let's get into it then. So firstly, if you have an interview coming up, huge congratulations. That is a massive thing. You know, it is a huge achievement. And just to contextualize that a little bit, for anyone that hasn't heard or doesn't have an interview coming up so far, in my cohort, currently, so I'm in my 2nd year of training, and in my cohort, over 660 people applied. There were 90 interview spots and 36 places. Just to give you a little bit of context. So remember those numbers. That means that only 13.6% of us were offered interviews. And it also means that only 5% were offered a place. like, that does not mean that 95% of the applicants were not suitable. That's not what that means. It means that the numbers are ridiculous, you know, and actually really, really worthy candidates, suitable candidates that will be brilliant on training, don't get an option of even being interviewed. So it's not the be all and end all. It is a massive achievement if you get it, but just remember the numbers if you don't. Like, remember the numbers. It's really important. And remember that you don't have to jump straight into doing any preparation. Like, it's okay. Like, you probably will have a few weeks as a minimum, or like a few months at a maximum of how much time you'll have from finding out you have an interview to when it actually happens. So remember, just, you don't have to jump straight into it. It's okay. So let's talk about invitations to interview then. Some of you might be waiting for these at the moment, and I know how hard that is. Honestly, I don't think numbers go high enough for how many times I refreshed my emails in that time when I was waiting for them. It was horrendous. I really do feel you. But usually what will happen is you will receive an email first giving you the outcome of your application. So that either is being offered an interview, a reserve for interview. So if someone pulls out or cancels their interview, then you will be offered that spot, depending on where you are on the list, or not successful for interview. And all of those outcomes will come via email. And then your clearinghouse status will change. So the website has actually changed since I applied. So it might be quicker now, I don't know. But for mine, it was like, it was a good 3 or 4 days before my clearinghouse status changed for most of the things. So yeah, keep an eye on your emails more than the clearinghouse, I would say. And then usually application outcomes are returned between February and March, which is why that's sort of happening now. I think the deadline's in the next couple of weeks to hear back. So you should all be hearing back soon. Fingers crossed for you. And then interviews usually run between March and May this year. So on the course that I'm on, they are running at the end of March, I think, the last week of March. So yes, that's when they're going. But this does vary. A lot of this does vary course to course in terms of like when you might find out, and there are some useful dates on the clearinghouse website available. And when I upload this one to YouTube, I'll make sure that I have all of the helpful resources down there in the description, so that all the links will be there. So let's think about what they're looking for. Okay, now this is $1 million question, I appreciate, and it's also a little bit like how long is a piece of string? Like, it's a bit tricky. So it really depends on the course. Okay, it really, really depends. Like I said, they have a huge list of characteristics available, and some courses like some things and some courses like other things, and it is just the way that it is. But having a clear understanding of what your course that you're interviewing for is looking for can be really helpful. But broadly, they will be looking for someone who kind of knows what to expect on training, and can demonstrate how they might manage the demands of training. So there's a huge amount of funding being put into trainees, huge. And they need to make sure that you're not going to drop out, that you're not going to find it too intense, that you're going to be able to cope with it. And also that clinical psychology is for you and training is for you. Because if it isn't, and if you're a bit unsure about it, it can come across. So knowing what to expect is really important. And you can gain that by talking to trainees, by watching some videos to see what training's like, or speaking to clinical psychologists, because they have all been through training at various stages. So it's important that you know exactly what training is kind of going to be. That will help. Also, they want someone that understands clinical psychology as a profession in an NHS context. Most courses are about that, and an enthusiasm to work in the NHS as well. That is a particular requirement on my course, and I think quite a few other courses. It's hopefully it will be helpful. And I think the reason again for that is because, it's an NHS funded course. You need to have an enthusiasm for the NHS and a belief that it works and that it's useful. We don't go into this necessarily for money, so understanding what the struggles are of the NHS currently and what clinical psychology means in there. And as I say, I've done a video on how clinical psychology functions in the NHS, so that might give you a bit of context. But there's plenty of other things that you need to read as well. Also, someone that has enough clinical experience to be able to work as a trainee on placement and can demonstrate this in an interview. So it's difficult because lots of courses will only specify 6-12 months of clinical experience, and everyone is very different, and it might be that the quality of that experience was really, really good for you, and 12 months is enough. My first 12 months would not have been enough. It wouldn't have been sufficient to understand what clinical psychology is and what it means. So I'm actually weirdly grateful for having the time that I've had, because I've got lots of different experiences to pull from, because they really do ask you to do that when you're on training. And also when you are put on a placement, the level of support that you have might be variable. You know, some people will have supervisors that are really, really want to encourage you and make you, learn. Some might be a little bit more, you can do this on your own, a bit more helping you learn and develop autonomy. So it really depends, but you need to be able to manage working on placement. So enough clinical experience to be able to do that. But your clinical experience will have got you there. They wouldn't be interviewing you if you hadn't met the shortlisting criteria of having enough experience. So you need knowledge of basics like risk management, using supervision, how to build a therapeutic relationship, etc., etc. Also has some knowledge of research design. So this does not need to be that advanced for most courses. And now I'm on training, I do wish that I had a little bit more experience with research, although we do have fantastic people in the cohort who are brilliant with it and really help. But I do wish I had a little bit more knowledge. But for the interview, all you really need is a basic knowledge of what makes a research study. Like if someone asked you to design a research study to see, I don't know, the impact of exercise on anxiety, what would you say? Like that sort of thing might come up. So a research designing question would be something that might come up, but having a basic knowledge of those things is helpful. So again, it really does depend on the course, but those are some of the broader principles, I would say. So let's think about preparation, because that's really why we're all here. Interviews are coming up. We want to make sure that we can prepare properly. So the basics of preparation, let's get into it. And, I'm preaching to the choir here. I appreciate that, because we're all mental health professionals and we tell people to do these things every single day of our lives, but sometimes following them is a bit difficult. Try to prioritize your sleep the night before. So I'm quite an anxious person naturally, and I did not sleep all that well before any of my interviews. But what I mean by that is, like, I made sure that I got into bed at a sensible time, and I'd had a bath, and I was as relaxed as I could be. Like, try and prioritize that if it helps. Some people find that they really buzz on only 4 hours sleep, and that's also fine. But for me, I'm much more of I need my 8 hours kind of gal. Also, make sure that you eat breakfast on the day. Again, I know it's such a basic, but it will give you that energy that you need. Even if you might feel like nauseous with anxiety and stress, like it will be okay. So also drinking enough water and trying not to have as much caffeine and all of that basic stuff, because caffeine can make us feel more anxious. And also your standard anxiety management techniques. However you manage your anxiety now, could be breathing exercises. One of my personal favorites that my dad always told me is to kind of imagine your loved ones behind you, like they're there, they're supporting you, their hands are on your shoulders, they're there to support you, and you've got like your army behind you. That was always one that really helped me. So any of your basic anxiety management skills will be useful, because depending on how the interview works, like some of them will be face-to-face, some might be online. Depending on how that is for you and managing your anxiety, it can be a longer process than you think. Like if you're there for face-to-face, it could be like a whole day that you're there, like dealing with trainees and other people and having talks and other interviewees, and like it can be quite stressful. So yeah, having some ideas of how to manage that is going to be useful. Also, key things to remind yourself: you have worked hard for this interview. It may not be that you've done loads and loads of preparation, and that's actually okay. That's actually preferable almost. But you have worked for several years probably to get this interview. So, well done. It's massive. And also, you have met their shortlisting criteria, right? So they know that you have got a good amount of clinical experience. They know that you've got some research acumen behind you, that you've got some experience in that. They want to now hear what that experience has meant to you. This interview is your chance to show them how you would approach training. Think of it that way. It's all about how you would approach training, and they're trying to assess what kind of trainee you're going to be. So just remember those couple of things. Let's actually get into some of the things that you can do for preparation. Try and do some focused reading and research. So if anyone's watched any of my previous videos, I've mentioned this a lot. When I had my first interview, I was like, I'm going to get on this year. It's going to be amazing. This is in 2019. And I filled up notebooks, reading all sorts of stuff. I had a whole list of things that I was reading. Couldn't tell you a single thing about anything I read. Even now, even then, when I went into the interview, I couldn't remember. Don't over prepare. That is my key message to anyone ever. Do not over prepare, because it's not helpful. Be focused. Really think about what it is that the course care about, and also what it is that you want to say. So the key things that you can think about is, the course you're interviewing for. Think about what's on their web pages, what's on the clearinghouse entry. Are there any YouTube or Instagram accounts where trainees are on that course? Or any of those sorts of things that you can see what trainee experiences are like. I'd really guarantee, actually, that there are some reflective accounts on there that really do show what training is like. And also Facebook groups, things like that. Try and find out as much as you can about the course that you're interviewing for. What sorts of things they like, what do they value, how do they approach their teaching, what's on their curriculum, if you can even find that. That's hard to find, though. Then also think about the trainee's clinical psychologist job description and person spec, okay? Because remember, this is a job. I absolutely appreciate it's training and it sets you up for things, but it is a job at the end of the day, and that's what they're interviewing for. They are interviewing for a job. So make sure that you go through that and think about some of those questions that could come up. You've all done interviews before. All interviews come from the job description and person spec often. So have a little think about what comes up on there. Are there any bits that you don't have? Are there any bits that you really, really nail? Have you got any examples of those kind of experiences? Like if the job description says, I can't think now. If the job description says working with people in a paid capacity clinically, well, what experience have you got for that? Really think about that. Also, if your course values research, and you have to do research in all courses, but some will emphasize it more than others, you could look up research design and any particular kind of analyses like t-tests or ANOVAs, so you can explain them to someone if they need to know, because there are some courses that do ask you those sorts of questions, and there are some courses that will do a research interview, so it might be helpful to find out. But for most courses, probably not something you need to spend loads of time on. If your course teaches systemic as a secondary modality, you could read up about this a little bit. If they teach psychodynamic, you could read up about that. But remember, it's a training course. They're not expecting you to be competent, qualified therapists in all the modalities. They're way more interested in what sort of person you are and how you approach different things. And that's kind of how the interviews are designed, really. Also, possibly you could think about some recent research studies related to your clinical experience. So when I was interviewing, I was working as an assistant in a kind of talking therapies IAPT type service. And part of the role was increasing access for older adults. So I read a bit about that. I read a research study about that. And I think I did end up talking about it in the interview. I think off the top of my head I did. So, but make sure it's related to your clinical experiences as well, because that kind of shows that you're making some research practice links, which is something that clinical psychologists do, and that's what we're encouraged to do on training as well. And then finally, the DClinPsy competencies. So there's a big list around, and I'll make sure it's in the description when I upload it, but also remember, yes, the competencies are important, but you're not expected to hit all of these. That's almost not what they're assessing, but having a knowledge of what the competencies are that you're expected to meet on training will be useful. So, if they ask you, why do you want to train to be a psychologist? Well, then you can say, actually, I've looked at the competencies and it looks like a job role that I'd really enjoy, or I've got, a foundation in this, and I want to develop this. It can help answer some different questions that you might not have expected, but all of these things help you demonstrate that you understand training, that you understand clinical psychology, and that you understand the course that you're interviewing for. And they're important. They are really important. So, what should I prepare? Well, again, some more specifics. One research paper you could talk about, and that means kind of being able to describe it, critique it, and apply it to practice. Those are really the main things. And it doesn't need to be really in depth. It just needs to be, so-and-so did a study last year where they did this, and I think maybe this could have been better, but actually this was really good. And then actually applying it to my practice, I've noticed this, this, and this. There are ways of applying it like that. So I would think at least about one research paper that you might be able to talk about. Again, it may not come up, it may not, but it will be useful because that demonstrates that you understand research and those research practice links. 2 to 3 case studies. or experiences where you learn something. It could be clinical work, it could be research work, it could be anything, but thinking particularly about where you've learned something. So this could be clinical case studies, like difficult experiences where you've learned something, or an experience where you demonstrate that you've got lots and lots of skills. And that could be skills in supervision, it could be teamwork, it could be clinical work, it could be assessing risk, it could be all sorts of things. So, for example, you could choose a case where you had a risk concern or a safeguarding concern or something, and you explain that to the client that you had a concern, that you were going to talk to your supervisor about it. You followed the procedure, you spoke to your supervisor in supervision, you made a plan together, you followed out the plan, you documented all the risks, and you shared it with the team. That shows all of those competencies I said. So teamwork, risk assessment and management, and using supervision, as well as kind of communicating with a client. So try and think carefully about those sorts of things, and it can be helpful sometimes to have the job description or the competencies up when you're picking your case studies. Some research examples as well, like having one that you might be able to talk about, like an audit or a service evaluation, studies, dissertations, something that you might be able to talk through if they ask you, give me an example of a research study that you've done, or whatever it is. It would be useful to talk about. And in your preparation, I would really encourage you to use reflective models to better understand your experiences. If you've followed us for a while, you know that is what I'm all about. But that was actually feedback that I had from my second interview. My second interview. And it made all the difference, because the year after I got my place. So I really do think it made the difference. And it's not necessarily that you're going to structure your answer using that, although you can. It's more about, if I understand my experiences well enough, I'm going to know which competencies I'm going to hit, and I'm going to be able to talk about them in a different, reflective way. So I think those are some things with case studies to think about. Again, with case studies, it's useful to think about a couple of different formulation models that you can use. So it could be the CBT hot cross bun, it could be the CFT threat drive soothe, it could be the ACT hexaflex, it could be whatever model that your service uses that you feel comfortable in. And that's what I would encourage you to do. Don't try and pick one that you don't really know about, because it's really useful to have it applied to practice. If you can think of a new one, great, but think about how you would apply it to practice. And sometimes I think we speak about things differently when we've done them, rather than if they're hypothetical. So I'd really try or even reformulate a case that you've worked on. If you formulated it with CBT, but actually maybe CFT would have helped, think about it that way. So think about, how would you use one of these models to explain a case you've been working with? How helpful is that model? Critique it. Like, has it been helpful? Are there bits that are missing? Like, could you maybe use an integrative approach and consider lots of different things? Think about it that way. And are there any issues with the model? So, because again, that's about applying theory and practice. So that's what they're looking for, because that is something we all develop on training and beyond. And that's something we really need to, that's something they will want to know, whether you are even aware that that's what training and clinical psychology is, but also that you're even able to attempt it. So that, I think that's a really important part of it. And then also notes. So what I mean by notes is, sometimes when you're online, you might be able to have like notes right now. So I've got notes of things that I want to talk about, and it could be that you could have them either side of your screen. I did do that for one of my interviews, did not find it helpful, so I did not do it for the second one. I actually found it really distracting. So think carefully about the sort of notes that you might want to use and how you want to use them. And it might be, if you're face to face, you might want to take a few little notes, and then you might be able to look at them through the day. Or you might think, I don't want to do any of that. I'm just going to go, and I'm going to see how it goes, and I'm going to trust my instincts. And that's also fine. But it might be that you want to have a couple of notes just to remind you of things. It's up to you, whatever helps. And then also, I would read through all of the information that the course gives you about the interview process. So they normally send you an email, and they'll also probably attach some sort of process of how it works and what it will be. And closer to the interview date, they'll send you some more information. Just read really carefully through all of that, and just make sure that you know exactly what the process is, what you're expected to do. Any questions, talk to the course, because that is really important. A few more things to prepare. I'm going to talk about mock interviews, because this is something that just fills me with fear when I think about doing mock interviews. And usually I think it's worse because you're doing a practice interview basically with someone that you know. That's why it's usually quite scary. So it could be with supervisors, it could be parents, friends, or colleagues. But yeah, usually it's worse because it's people that you know. But in my experience, mock interviews have been really useful, because you can, what you're trying to do is replicate the interview setting as much as possible. So if it's face to face, do it face to face. If there's a panel, try and do it with as many people as you can in that panel. If it's an online one, try and do it online and really set it up properly. So like you get called in, they do a bit of blurb, and then they ask you some stuff. Like try and replicate it as much as possible. And that's why it's helpful to read through the interview process stuff before. Choose someone that knows the sorts of questions that might come up. So someone that's been through the process, like it could be a trainee or someone that's interviewed before, or a clinical psychologist. Or you can provide a friend or family member with some questions that they can ask you, because that can also be really helpful. And the thing is about these, I know they're scary and I know it's difficult finding time, but you can gain feedback on how you answer, how you approach questions, how you handle your nerves, how you come across. It can really help because it's practice. Practice makes perfect. Like, we do need to practice these things. And that's why we have 3 years of training to practice being a clinical psychologist. So mock interviews can be very helpful. But I also appreciate that's not an option for everyone. Not everyone is going to have someone that they can go to for that. So this is an alternative that I did as well. And it is embarrassing. And I have deleted the video since. But you could record yourself answering questions into a video camera, just like this. Maybe to watch back, but maybe not. I never did because I couldn't cope with it. But what it did is it helped me get used to speaking out loud for like 5 minutes. Because listening to your own voice for 5 minutes in a room full of other people or online is it is strange. So it does take a bit of practice. But if you want to watch it, then you can also see how you come across. That it helps. So there's a few little bits for what you might be able to prepare. But I'm going to come on to some tips now for preparation. What's your perspective? It's really helpful having research and evidence and theories and models, but what do you think about them? Like, what have you noticed from your practice? They interview so many people. It could be like 150 people that they're interviewing, even more for the bigger courses. So what is your perspective? What do you think about things? That's actually what they care about more. And authenticity really does come across. If you're giving a perspective that you kind of don't instinctively agree with, it comes across. So really spend some time, and that's why the reflective models are helpful. Like, really spend some time thinking about what your perspective is. And also what things you value. What sort of clinical psychologist do you want to be? What sort of work do you want to do as a clinical psychologist? What do you think clinical psychology will look like in the future? What do you want it to look like in the future? All of these questions are really useful, reflective tools just to think about things. You can write down or record. So this is an idea, and this is something I always did in exams, like written exams at school. I'd do a brain dump before I went in, or when I sat down just to do it. I'd write down my worries and a brainstormy cloud thing of what I was thinking and any worries I had and random thoughts that come up, because they always come up at those times. And for me, it just kind of helped, okay, got that stuff out of my head. Now I can really access the important information. So you could write down it on your phone. You could go outside and do a little voice record. You could do whatever it is that helps. It might not help, and it might just be really confusing, but have a go. Practice on your mock interview if you can. And then remember, you cannot know everything, so don't try. They don't want you to know everything, because if you know everything, you won't get taught anything. And if you have the attitude that you know everything, then what is the point in coming to training? Because you're very much in a spot of, I don't know what I'm doing. And it's okay to say that. It's really, really okay. You were chosen based on your application form. They know what you have done. But now you want to show what you've made of that experience. So I'm going to talk through some interview themes. This is the next kind of thing. Before we get on to what to actually do during the interview, we're going to talk about some interview themes. And a little caveat, this will not be universal, and there will be things in your course, in your interviews that come up that may not be on here. But here are some of the really main themes. Research-wise, they will want to know whether you have an understanding of basic research design and methodology and knowledge. They will want to know if you can interpret and disseminate research, because that is an important thing that psychologists do and that we are taught to do on training. And also making those research practice links. If you can work out ways of doing that, kind of the way that I've said, thinking about a research study and how it might apply to your practice and how, it could lead to further research and things like that. Some courses prioritize research, some don't, in the same way. So it's just something to consider. Clinically, clinical situations and what you might do or what you have done. So with clients, with supervisors, with colleagues, any of those sorts of, in job interviews when they say, tell me a time where you did this, they're probably not going to give you questions like that, but they might give you this situation happens, what from your experience will help you manage it in the future. Something like that. I don't know. That's not an actual question I've had, but it might be something more like that. So really thinking about those case studies will be helpful for that. And then again, application of theory and models to real life situations, that theory practice link. So really using formulation in real life and critiquing it. And then some wider issues. So current context of clinical psychology, what does it look like? What are the issues within it? Where is it going to go in the future? What are some of the future directions? And then thinking about widening access to courses in clinical psychology, because that's a big narrative at the moment. And also thinking about diversity and anti-racist practice and decolonization. All of these things are really important in clinical psychology currently, and they're all things that courses are attempting to do. So having an understanding of that will be useful. Again, some courses are going to value that way more highly than others. So knowing what your course really values is the key thing. So before we go on to during the interview, I'm going to just double check and see if there are any questions. Hey, great. Oh, wow. Yes, sorry guys. I've just seen the comments about there not being any sound. Okay. So I'm just double checking some of the questions. I think what we'll do is I'll go through the questions at the end. Because I think that will be a little bit more helpful than me just like blankly looking at them now. So let's talk about during the interview then. Let's talk about how interviews work. How do they work? Could be online, could be in person, could be a combination. Depending on the course, lots of them are trying to do them in person now, but some are offering choices. They're trying to be flexible. So it will depend on the course, sorry. They may have a time limit for providing answers. I expect they will, because training places are increasing in most places, so they are interviewing a lot of people. I expect that there will be a time limit. Some places will be very formal and will say you have 5 minutes per answer. Some will say you've got 45 minutes today to answer the questions as best you can. We might prompt you. It might be a little bit more relaxed. But there's likely to be some sort of time limit. You will probably have at least one interview. All the interviews that I've ever done, it was just one interview. And there was a panel of interviewers. So often a member of course staff who's like a course tutor, clinical psychologist, a local or regional clinical psychologist who's like a placement supervisor, and a person with lived experience. So those, usually you'll get at least 2 of those. You should be getting all of them, but yeah, you'll get a combination, probably. Some courses do academic or research interviews as well. So that, as well as the clinical interviews, some of them do separate them like that, but not all of them. And also some places will have an additional task that may be before or during or after even the interview day to help them make their decision. So this could be role plays, it could be group exercises, it could be written exercises, it could be deductive reasoning, it could be, all sorts of things. And we are going to come on to talk about them later on. There's a whole section. And also, just an important one, you're unlikely to be able to ask questions at the end, like a normal job interview. They won't normally allow time for that. They might, but unlikely. But usually if you're in person, they will give you, hopefully some trainees will be there. There'll be other course staff that you can ask questions to. And also some courses make a kind of buddy system. So you'll get a trainee that you can have a meeting with before. So during the interview then, breathe. Like, I know it's a really obvious one, but it's one that really helps me. Just take time to do some deep breathing, because it will slow that heart rate down and it will manage that anxiety. So make sure that you breathe, and remember to smile at least a few times during the interview. Like, it honestly does wonders. It's a very different situation for me smiling like this to kind of talking like this and being very nervous and very scared. Like, there's a very different thing there, and it's it's a subconscious thing. When people smile, we tend to feel a bit warmer with them or feel a bit closer. But when they're a bit more like this, like there just isn't that same thing. Hopefully that demonstrates it. But just at least try and have a couple of like nicer, warmer expressions on your face. Also, choose an outfit that you feel confident in. This is for people of all genders. Feel confident in whatever you're wearing, including if you're online. I wore like my nicest pair of heels when I did my interview because I was online. I was like, I want to feel confident and good and ready, and it really helped. Like it helped in some way. Every little helps. Also, for online interviews, make sure that you have a quiet, private space. And this is something I did in mine because I find it really distracting to have my face on the screen. So I covered it with a post-it note. It did fall off actually a couple of times, which was even more distracting than having my face. But you can cover it in some way or kind of put your phone over it or something. And also, this is a really important one that feels really strange because you've got a screen full of people and you want to look at them because that's what we do in normal life. But you need to look at the camera like I'm doing now. You need to look at that camera. Again, subconsciously, it does make a difference. It makes them feel like you're talking to them. So I think that can be really useful. For face-to-face interviews, know where you need to go. Do a trial run if you can. Obviously, if you're applying somewhere that's far away from where you live, that's going to be trickier. But maybe do it on Google Maps or something. Street view. You can do it that way. Just know where you need to go. It helps with my anxiety. I went before I had I was like ridiculously early for my only face-to-face interview. But I was happy. I was there. I could relax. Like it was fine. So yes. Let's think about structuring your answers, because this is one of the biggest questions that I get when people do my monthly Q&A on Instagram. All of the questions that I get around interview time are, how do I structure my answer? How do I answer the questions? What do I do? So I would advise you not to answer the question straight away. If you get given the question, don't just go, oh, because then you're just going to get your initial thoughts. And it's, I would say, quite rare for someone to be able to immediately answer having a really well formulated answer. So I'd encourage you not to do that. I'd encourage you to take a deep breath as they're asking the question, and also take a moment before you start answering. Like, you could take another breath. You can think of your key points. You can even write them down if they allow that. So in my in all of my interviews, actually, I have written down the things that I wanted to say. And I've told them that. I've said, I'm just going to write down some key points of the things that I want to say to make sure I cover everything I want. And that should be okay to do. If it's not, they'll let you know. But it's practice both when you're doing your practicing. So I'd write down your ideas and your key points and explain that that's what you like to do, as I said. So when I say your ideas, there might be like 5 ideas that come into your head to answer a question. So write those down and think, oh, that one links to that. Yeah, okay, cool. Right, I've got a bit of a structure now. And you'll find that you will be able to kind of follow that structure if you have it. And then I would also encourage you to show you're working. And I know this sounds strange, like not literally hold up your writing, but briefly summarize your ideas, like the alternative perspectives that you could have chosen, or name checking other models you could have used. Like you could have say, initially, if someone says, I don't know, talk about some different models that apply to practice, you could say, well, I've got a lot of experience of using ACT, but actually I'm really interested in CFT, and actually maybe a CFT approach would be useful here. You could be doing it that way and then talk about the CFT approach. But what feels important as well, and anything that sticks out to you about the question or anything that you're curious about, think about it. Because they want to know how you approach things, not that you can answer a question perfectly, however that is. They want to see how you approach things, even when you maybe don't expect a question. What knowledge and experience can you draw from to answer that question? And actually, a lot of the questions are designed so that you can't practice. Like you can't, a lot of them are designed so that actually, you can't memorize answers. Like they really try and think about different situations that you will not have experience in and think about how you can apply things to that. So be ready for that. And also, if you don't know how to approach something, don't panic. Think of some other ways you can approach it. Talk through them once you've formulated your response. Tell them you don't know. It's okay to do that. They're not expecting you to be perfect. Just tell them. Just say, actually, I don't know. Let me think about that. That's okay. Like it's completely okay to do that. And they would actually prefer that to someone waffling away going because they can't think and all they're doing in their head is panicking. Just saying, oh, that's an interesting one. I'm going to need to think about that. That's okay. That's fine. Again, authenticity, it really comes across. So show you're working. Some other ways of structuring answers, having a clear way of answering the question. Okay, so as I say, that could be 2 to 3 points of things that you want to talk about. It could be talking through design of your research. You know, if it's a research question, it could be what the research was, what you did, how it applied to practice. You know, it could be whatever it is that you want to talk about. You could use some models like STAR, situation, task, action, response, and reflection. You could use that. Or you could use the kind of standard, this is in lots of reflective models. What, so what, now what? You can use all of those things. For me, I found them quite distracting, and I'd be like, oh, STAR, what does the A stand for? And I just couldn't remember. So for me, the 2 to 3 points felt better. And then I would always encourage you to add in your ideas at the beginning that can help kind of structure your answer and show breadth and depth of your thought. Like I said, oh, that's interesting. My initial response is this, but also maybe thinking this and this. Yeah, okay, so I think this, this, and this. And then also always, summarize your points at the end. Even if you hate your answer, even if you think it's rubbish, summarize your points and then make sure you have answered that question. How does your answer address that question? That is the main thing, because they need to score you on whether you have answered the question and also what things you've brought in. So make sure that you always summarize your points and conclude it back to the question. And it also makes you feel a little bit better about it as well. If you're like, okay, those are my points, that's how I answered the question, next. Like, it can feel a bit nicer. During the interview then, again, take each question as new. You're not going to answer every question in a way that you'd be happy with. It's not going to happen. So take each question as new. Take a deep breath once you've finished your answer. Use a grounding technique to kind of bring you back in the room, like 5, 4, 3, 2, 1, or rubbing your hands. If anyone doesn't know 5, 4, 3, 2, 1, it's going through the senses. So it's like thinking of 5 things that you can see, 4 things that you can hear, 3 things you can touch, going down that way. You may not have a chance to do all 5, but you may be able to just think, okay, what can I touch right now that can really bring you back, and just go, fine, forget that, I'll debrief afterwards, I just need to get on with it. And each question is an opportunity to show them something else about yourself. Like, think about it that way. The next question is completely different from the last, and it may, the last question might be something that you are really not very strong in, and that's okay, but you will have strengths in other areas, so there will be questions coming up for those areas as well. And remember that silence is not always scary. This is something therapeutically we have to learn anyway, isn't it, in clinical situations, that actually silence isn't always terrible. But the panelists will take some time to write notes. Like, when you finished your answer, there might be time where you're just kind of sat like, ta-da, like, I finished my answer, what do I do? They will be writing notes because they want to make sure that they get everything down so they can score you properly, because they score afterwards. So yeah, they'll take time. You'll also need time before you think of your answer and before you answer the question. So there will be some silence there, and it's very easy to have those thoughts of, oh my God, they're looking at me while I'm trying to work out what my points are, and it's silent and they're going to judge me. Just remember, it's not always scary. It is expected. And also, I would try your best, if you can, to practice being given a question and taking time in silence to plan it and video yourself. And what that will help with is almost like a bit of a behavioural experiment, because if you think that they're going to be judging you for taking time to write that down, and you're going to look silly because you're going to look confused and you don't know what you're doing, record yourself and see if you look confused and like you're flailing around. You probably don't. Like, you probably look like you're someone that's writing something down and planning your answer. So think about it that way. So reflection is also the other massive part of things that I get asked. Is like, how do I reflect in the moment? How do I be reflective in a question? How do I do this? So we're going to think about this. Reflection isn't always a big, distinct, I'm going to do some reflection now. Like, it isn't always that. It can include, oh, I was thinking X and now I'm thinking Y, or maybe Z. Like, it could just be voicing the thoughts that you've got and thinking about, no, maybe X isn't this because of this, so I'm going to go with Y, and this is why I'm going with Y, Or it could be, I have lots of ideas about A, B, and C, but on reflection, considering my experiences, I think D and E actually would be more relevant to the question. It's something like that. And you could use what, so what, now what. So you could explain a situation using what. You could explore how that experience made you feel, what you found difficult, what you learned, so what. and what that experience means for your practice now. So now what? You could use that structure. If it's a particularly reflective question and it's asking you to do some reflection, that can be a nice structure to use. But it isn't always about that. You know, if you've used some reflective models to understand your experiences, you will naturally speak reflectively about them. And I guess on the question, we had a question in on Instagram, how do I reflect in the moment? Not all questions are going to require reflection. You know, so if they ask you about research, it's probably not going to require you, you know, if they say, tell me about a piece of research that you've done, you're not going to go, oh, well, on reflection, this, like, it's not called for, it's not needed. But if they're asking you about a clinical case, they're implicitly asking you about reflection. So add in a little bit about what you thought the case was, what you thought it went well, what you thought you could have worked on, what you've learned from it, how it applies to your practice now. That's always the most important thing, how what you've learned applies to your practice now. So yeah, I mean, that's my main thing on reflection. I will talk about the reflective models a little bit, and like I'll give you some names of them, and I've done videos on pretty much as many of the big ones, so I'll make sure they're in the description as well. Let's go on to additional interview tasks then. So not all courses do them. All the courses I've interviewed for have done them, and they've all been written things at some point. So additional tasks could look like role plays, individual or group, and we're going to talk about role plays. Case discussions as a group, case discussion as an individual with the interview panel, writing a letter to a client as a therapist after watching a video of part of a session. Could be writing a formulation after watching a session or reading a vignette. It could be answering written or verbal questions about a video that you've been shown. It could be critiquing a journal article. It could be some research methodology and design tests they might want you to do. They might ask you questions about it. There's a huge range of things that they could ask, and it will depend on what the course are looking for. So I am going to talk a little bit about role plays because that's the main thing that I get asked about. Role plays, they honestly still make me terrified, and we do quite a lot of them in training, but they are just uncomfortable. They are awkward. It is just one of those things, but they do form a key feature of training. So it's important that they see that you are able to engage with them and kind of almost put that awkwardness hat aside. And that's kind of what they're assessing there, as well as some other things. There's a big range of options, all assessing various competencies. Clinical situations could be role playing, a group team discussion about a client. It could be supervision. It could be clinical situations like therapy, assessment, risks management, ending a session. And what they're doing there is assessing your professional manner and your ability to build a rapport and what you are like as a therapist. That's what they're trying to test. And they also will always take into account that you're nervous. Throughout the whole interview process, they will take that into account. But also assessing that you understand the basic boundaries of clinical work. Like, you don't swear, you don't say any demeaning comments, your body language is appropriate, like a lot of that sort of stuff as well that they're testing. I mean, those are really basic things, but you'd be surprised. They're also assessing your understanding of the role of being a psychologist. So, for example, not promising to see them every day for 3 years, you know, or whatever it is, promising to give them your personal phone number so they can call you 24/7. Little things like that. And also not, you know, advising on nutrition to any detail because we're not qualified dietitians unless you are. You know, those sorts of things. That's what they're trying to test. There could be some team discussions, like a role playing a team discussion. I think it's fairly unlikely because assessing in a team might be a bit difficult, but it could be assessing if they do, it might be assessing your ability to work with other professionals, you know, having that professional respect and also having some assertiveness and some supportiveness as well. And assessing your ability to summarize and communicate psychological information to other professionals, because that is a big part of what qualified psychologists do. So that could be big. And then supervision. They might role play a supervision with you and they might ask you to talk about a client that you're working with, you know. And what they're doing there is assessing your ability to use supervision, because we have so many supervisors on the course. It's crazy how many supervisors we have. So yeah, you need to be able to use supervision, and that might be something they want to test. They're also assessing your knowledge of what is and what isn't appropriate to bring to supervision, and also what the boundaries of a supervisory relationship are. You know, it's not therapy. It is clinical supervision. So they're assessing lots of things there. And there are lots of ways that you can do role plays, but I've done a few little tips here. So breathe. It's always my tip. Just make sure you try and focus on your breathing and take a deep breath. It really does wonders. Take time to consider the information that they've given you before. So if they've given you a vignette to talk about, if they've shown you a video, like really think about that and make detailed notes if that's helpful. Just spend some time thinking about how you would actually approach that if you were at work. Like, what would you actually do? Not what would I do as a trainee, because you're not a trainee yet. Think about what you would actually do. That's what they're assessing. You know, they're not going to be incredibly high risk, crazy cases that you would only work with as a qualified psychologist. They're going to be more cases that we would work with as trainees or as assistants or as support workers. Those are the sorts of things they'll think about. So it's not going to be anything crazy. Think about what you would do in your current situation. Again, make notes if you'd like, but you know, there are only a few role play scenarios where in real life you wouldn't be able to have some notes. Like, I take notes into clinical situations, I take notes into meetings. Like, you should be able to have notes. They might be funny about it, but you should be able to. You can always try and ask. Also, rely on your skills and experience. It's what got you the interview. Like, don't be letting that imposter voice get inside your head and say, you don't know what you're doing, what are you going to do, how are you going to panic, and blah, blah, blah. You know what you're doing. You do this as a job. Like, you work in somewhere in the NHS, most likely, or in third sector, or even private. You will work doing things like this. They're not going to throw you anything crazy. Now try to imagine being at work rather than at an interview. What would you do in that situation? How would you talk to your supervisor about it? What would you actually do? Like, really try and put yourself in that, like, sit yourself in your office or wherever it is that you work from and really think about what you would do, because it will help, I hope. Now, we're going to spend a bit of time thinking about after the interview, okay? Only a little bit of time, and then we're going to come on to the questions section. So, after the interview, I mean, massive congratulations. You might not feel like this. Like, you might not feel like, woohoo, smashed it, yeah. You might feel like, oh, I don't know how that went. This is really unsettling. Or you might think, oh, I bombed that. You never know. You never know. But you have completed it. So, one of the things that I'd recommend, and you don't have to, but it's one of the things that I find helpful, keep a record. Just keep a record of, you know, the interview questions. And this isn't necessarily to share them around, but it's helpful for you. If you don't get on that year, then you know what the interview questions were, because my memory is not good enough to remember something from a year ago. So I kept a record of them. Also, writing down the points you included in your answer, like really thinking about what it was that you included and would you change anything. I'm not suggesting doing this immediately afterwards, because, like, go and relax, go and enjoy yourself, like, go and do something nice, which is what the next point is. Reward yourself. Even having the interview is a massive achievement, and it's also a really stressful process. So make sure that you reward yourself. Do something you enjoy later on in the day or later on that week or in the weekend. Like, meet friends, get your favourite food, get cozy on the sofa and watch your favourite film. You can tell that I'm nearly 30. That is what I want to do. I don't want to go out. I want to be on the sofa. But also take a break if you can. Like, some people might get called for interview like the day before or on the morning of the interview. I've heard as well, if you're on the reserves, you might get called on the morning and you might be at work and you might have to go back to work straight away. But try and take as much of a break as you can. As I say, this is not for everyone. It might heighten the anxiety, actually, to kind of keep a record, particularly if you thought that it went badly. So you don't have to do any of this, but that's something that helped me. As well, waiting for the outcome. This is much like the advice that I'm going to give you. I wish I could have listened to myself, but I did not. I whipped myself up into such a frenzy when I knew that they were going to be emailing us and we're going to get the outcome on that particular day. I was petrified. I was so scared. And I basically just, by the time the outcome came that I was on the reserves for this one, we got emailed a letter and I just misread the letter. Like, I just couldn't function. Words were like squiggles on a page. I was way too anxious. So try to distract yourself, like book in some busy things for work or do something fun. Use your anxiety management techniques. All of mine went out the window. I did not use them. I could not stop myself from going into the anxiety pit. And that might be your experience as well, but I would really encourage you to try not to fall into the anxiety pit. And also feedback. If you're not successful, you will be offered some form of feedback, and it could be a meeting with your panel's chair. Usually that's what it is, like a telephone call or a video call with the panel's chair to give you some feedback. If you're on the reserves, you might be offered feedback, but you might not. Some courses do, some courses don't. Some courses do because they're like, the reserve list might not move as much, and you know it's helpful for future interviews. Some don't give you feedback because they say you're good enough to get a place. If we had enough places, you would be getting a place. So we don't have any feedback or anything for you to work on. Which, like, I get, but, like, also, if you've applied lots and you've interviewed lots, like, you just want some feedback on how you can make yourself better and how you can score better. But keep a record of this feedback as well. That will be helpful for future times if you need to apply again. And always receive your feedback. I know that sounds silly, but sometimes, like, you might get busy or you just might forget to do it. Like, always receive your feedback, because it is, however hard it might be to listen to, it's always helpful. Thinking about outcomes then, let's think about them. If you have been successful, you will most likely receive a telephone call offering you your place, which is just an incredibly emotional time, or it was for me anyway. It was the day before the deadline, and yeah, I knew I was number one on the reserves, and I just needed one more person not to take their place, and then I was offered it, and it was a very, very emotional time. If you're on the reserves, you will receive an email afterwards. Usually, they might call you. It depends on the course, but usually you'll get an email. And if you're unsuccessful after interview, you will get an email as well. And then your clearinghouse status might change later on. So yeah, and then if you are successful, you will be able to accept or decline your place through that website. And they always want you to do it as soon as possible, so they know how much movement there'll be on the reserves. But some people interview for multiple courses, so they might want to wait to decide which course they want to go to and go to all their interviews, which is absolutely their right. So the deadline for accepting NHS places this year is 2 p.m. on the 9th of June 2023, and courses usually will begin in September to October 23. So you've got a bit of time usually before you actually will be starting. But the other thing I would say is make sure that they have your correct phone number. So make sure that the one that was on that application form is the correct phone number. If it isn't, just let the course know and they will change it, because you don't want to be waiting around and then them have the wrong number for you. That's like, surely that's not what you want. So thinking about how I choose a course, if you are fortunate enough and talented enough to get multiple interviews, then you might actually get multiple offers. And then how do you choose a course? So sometimes how courses manage the interview process can reflect how they manage the course. This is not always the case though. Sometimes a course might be super organised and really, really brilliant and really thoughtful and flexible on the interview process, and you might find that they're not like that at all when you get there. And it could be the other way around as well. They might seem really chaotic on the interview day because it is a lot to organise, but actually they've got the course stuff together. So it can sometimes reflect how they manage the course. Location is going to be a big one, depending on what other commitments you have in your life. Choosing on location is going to be important. Also, your circumstances. You may not be able to travel. You may have children. You may be married. You may have other commitments. Also thinking about the course ethos. So if you are somehow interviewing for two courses with very different ethoses, think about which one suits you. And also, how did you feel on the interview day about the course? Like, how did you feel about the information they gave you? How was speaking to other trainees? Like, how did you feel about that? And also, how do they assess competence? Is it exams or coursework? I was very strong on the fact that I did not want to do exams. I'm not good at them. I get really stressed. I'm much better at doing coursework. So that is the course that I'm on. They only do coursework at the moment. So yes, that is one definitely to think about. Now we've come to the Q&A section, and while I give you some time to write down some questions in the chat, I have got some that were sent in from Instagram. So we've got, the first one here is, how can I be more self-confident? Well, remember that you've earned this interview. Remind yourself of that and give yourself those affirmations. You have been invited because you are skilled, experienced, and capable. And you also have the potential to be a trainee and to be a clinical psychologist. Also, try and frame the interview as a way of learning your current level of competence and development. You know, interviews often expose those areas of development. It might be that they ask you a question and you think, I actually just have no idea how to answer that. And I know it's frustrating because we want to progress our careers, but actually you can be like, I didn't know how to answer that and I did not come up with anything that I thought was suitable. That's something I need to go and get experience in. So you can't know everything. Remember that you have earned it. Do some affirmations. You have earned this. You have earned your interview. It's going to be okay. Also, I would also say, if you want to start like a psychology YouTube or Instagram, go for it. Because I was I was sure that I was never going to get through an interview at one stage. I was like, I'm never going to do it. And then I started this, and I feel much more confident talking without anything else going on. Like, I feel much more confident doing this. So it can be worth it. Or trying to take up some opportunities in work where you might be able to do some presenting. As scary as it is, you will realize actually, oh, maybe I do know some stuff. This is nice. And then it can grow your confidence. Also, why do people get rejected? Yeah, there's a lot of reasons. Overall, bottom line, they didn't score as highly as the other candidates. But that does not mean that you're not suitable or ready for training if you just didn't get offered a place. Remember the numbers, 5%. And it's probably going to change this year because there are more places, but there's more applicants. So, the numbers are crazy. It's not you, it's the system. I would really encourage you to remember that. It is a numbers game. They may need a bit more time to develop prior to training. You might need a little bit more, like I said in the last answer, you may realize actually I can't do this. This is not an area that I know anything about. You might need a broader range of experience prior to training. You might need to develop your reflective skills prior to training. There's so many reasons that people get rejected, but feedback from the interview is really important. A couple more questions and then I will go to your questions. How can I give a good impression? Be yourself. Authenticity is valued. It really is, and telling the truth. If you don't know an answer, say it. Talk around the subject and what sorts of ideas you have. It will be so much more interesting to them after they're interviewing 100 people, or your panel will be interviewing maybe 20 people. It'll be so much more interesting than giving one of the expected answers. It shows you're working. Like, try and be as honest. And again, smile for that subconscious effect. People warm to you if you're smiley. And the last question here from Instagram is how to prep and answer research questions. This will depend on what the question is, obviously, but having some understanding of research design will be helpful. How would you design a basic study, like a basic study? What elements do you need to have? Well, you need to probably have a control group, depending on what it is. You need to have an experimental group if it's an experimental design. What sorts of analysis are you going to use? You can do a literature review, like how are you going to recruit? All of those sorts of little bits that you need to think about. Then also some standard research textbooks might help. Andy Field, obviously, always, what a king. Psychology research methods for dummies. Like, you have got through your degrees by doing research. So you will have your own ways of managing this, and you'll also probably have some form of textbook around it. If you don't, go to a library. There's some good things that you might be able to find. There might be a psychology library somewhere online that you might be able to share books. I don't know. I'll have a look. But textbooks can be really helpful for that. Or even YouTube videos. There'll probably be some YouTube content around it. Not from me, sadly, because I don't know enough about research. And some knowledge of some basic analysis might be helpful. So t-tests, ANOVAs, correlations, when it's appropriate to use these. You're not going to need to know anything massively advanced, but they might want you to know about that. So think about basic understanding of research design, look at some of the textbooks on that, and think about some basic analysis. Those are the things that I would encourage. So let me come back to the stream and I will have a little look at some of your questions. Thank you so much, everyone, for putting some in. These are really, really helpful. So I've got one here. If I do a CAP Master's Apprenticeship focusing on adult population, can I still work with children? Oh, that's a really good one. I am not sure. I'm not sure. Is the answer to that. I'm modelling my advice on telling you that I don't know something. I would have a little look into it, and I would contact the course that do it. But we're mainly focusing on DClinPsy stuff, so I'm going to try and make sure that I pick on that. So what work experience would be good for the role as a trainee clinical psychologist? So work experience that's really valued, kind of in terms of clinical work, assistant psychologist roles, and that is mainly because you're doing what I call trainees and pre-qualified, like baby psychologists, if you like. We're learning. We're like junior psychologists is probably a more respectful way of thinking about it. But those sorts of roles, you are doing psychological work under the supervision of a psychologist. So you not only are doing the work, you are being supervised, you have a knowledge of what clinical psychology is in the current context of the NHS. That is why AP jobs tend to be really highly valued by courses, and you can get that same experience sort of, hopefully, in support worker roles. If you find a team where there is a psychologist, where there's a psychology team that you might be able to get a bit of supervision from, you know, you can have those questions. You can have those conversations with employers before you apply, if they're willing to. Just ring them up and say, have you got a psychology team? I'm really interested in this. Is it worth me applying? They'll tell you the truth, you know, hopefully. So, yes, I would think about, so support worker roles, particularly where there's a psychology input, also assistant psychologist roles, and that could be all sorts in all sorts of domains. Also, if you're starting out, thinking about healthcare assistant roles or healthcare support worker roles, thinking about anything that gives you that clinical contact, that face-to-face kind of client contact will be really useful. Yes, this webinar will be available to look back on. I'm going to do a recorded version, and I will take out all these questions because you lovely people have joined us all. So I will make sure that the question section is just for you who have joined us, and I will make sure that that's up there. I might do a written version of the questions and answers in the description on the uploaded one, but yes, it will be there. Another one here, are they likely to give a vignette or research paper in the 45-minute interview to analyse? Seems like a lot of time pressure if so. Don't know is the short answer. Very possibly they might do, and in that case they're not going to be looking for anything really full. They're going to be looking for what you think is happening. They'll be looking at what do you think are the key points and working with that vignette. And when I say vignette, it might not be like a page worth of stuff. It could just be Sarah, who's 29, has come to you in talking therapies and she's saying that she wants to kill herself. What are you going to do? You know, it will be more developed than that, I expect, but it could be something like that. So that's the sort of vignette type thing that it could be. I doubt they'll give you a research paper. That's quite unlikely because, you know, I can't even read one fully and understand it and process it and critique it in 45 minutes. So I doubt that. That might be an additional task that they give you. But I doubt they'll do that actually in the interview. Is there any advice when answering questions with a service user or representative being present on the panel? Yeah, I think it's interesting, isn't it? Because I'm really glad that people with lived experience are on the panel because they will have a different perspective than clinical psychologists will have. And they are used to working with people as a service user, and working with lots of different people often. So they will get a warmth for you, they'll get a sense for you, and I do think that's really important. In terms of any advice when answering questions related to them, I wouldn't have thought so. I don't think there's any need to kind of particularly focus your attention to them or anything like that. I think just answering the question kind of as if they were just part of the panel is fine. And another question here is, would we be scored less by repeating things we put in our application? I would say no. I don't think the panel saw my application. I don't think the application really comes into it once you've got your interview. That's my personal experience on all of my interviews, because I would say things like, obviously, you know my experience, and they'd be like, no. So I don't think so. I think you need to take it that they don't know what you've been through, because they probably aren't the shortlisters. You know, they're probably not the people that shortlisted all the applications, and they probably won't have your application in front of them. I wouldn't have thought. They might, and it might be worth just checking with them at the start, but I wouldn't have thought so. So what is the one thing you wish you asked or knew before starting training? Yeah, that's a really interesting one. I don't know if I have one thing. I had quite a good understanding of what training was going to be because I applied so many times, and I was, you know, I did a lot of research on it, so I knew what it was going to be. I wish I had asked how we're supposed to do all the work. I wish I'd asked a little bit more about study days and what that looks like, because there's very little time to do a lot of stuff. So yeah, I wish I'd asked a little bit more about that, and really thought about their answer. Was it just one of those kind of PR answers, or is it like an actual fair answer where they're really thinking about what you're saying? So yeah, I wish I'd known that a little bit. What are the pros and cons of the role as a trainee clinical psychologist? Pros, let's start with the pros, shall we? Pros, you are given a lot of time into what I've just said. You're given a lot of space and time to develop on placement. Certainly on placement, I've found supervisors generally have been very, appreciative of my level of training and my level of competence, and found me cases and given me work to do that is kind of just pushing me outside of that a little bit, but that helps you develop. So yeah, I think that's a really good thing. And also you are in a position where you can say, oh, I don't know, tell me about that, I know nothing about that, because you're a trainee. So you're almost given license to be able to say, I don't really know. And I've got a bit of a fear about when I qualify, but like people asking me stuff and me being like, I don't know, I don't know anymore, but I can't say that because I'm not a trainee. So yeah, that's a really positive thing. And also lots of the people that are in my cohort are fantastic, and I've made some amazing friends, and it's really helpful having them there because they're going through the same thing as you, and lots of people in your life won't appreciate what training is like, but as well because you may have tried several times like me to get on, so you might get a bit of, oh, but you like it, don't you? And I'm like, yeah, but it's just like it's just a lot of pressure and a lot of stress a lot of the time. So that takes me to the cons. Like I said before, we don't get a lot of time to do research on our course, and we're expected to do very high level impactful research, so it does take a lot of time, and we aren't given a lot of that, so there are a fair few evenings and weekends. You're almost, I don't know, it's difficult because you're kind of at the mercy of a course. They could place you wherever they want to place you. Obviously they'll take into account your competencies and things, but ultimately they are going to place you wherever they need to place you. So you kind of don't have control, which is difficult to manage sometimes. But yeah, I mean, on balance, I do love being a trainee. I really do. And I think in some ways I'll look back and be really grateful, but also right now we're really in the thick of it. Second year is hard. We've got 2 deadlines for our 2 out of the 3 research projects this year. We're coming up to the end of placement. We have another project that we need to, there's a lot of other things that need to happen in this year. So second year is quite tough, but third year I hear we get more study days, and we also have fewer big bits to do. We just have smaller, bigger bits to do, if that makes sense. So yes. So how do you deal with a question you don't understand and you have already asked them to repeat it? Yeah, that's a really good question. I would try and break that question down, and when you ask them to repeat it, when they repeat it to you, take out some of the key, write down if you can. That helps me because I'm quite visual. Write down some of the key points from that question and try and answer it as best you can. Try and take a couple of the key words and think, oh, maybe I'm thinking this and this and this. And if you don't understand it, just say to them, I'm still not really sure how to approach that. And then show your working. Think, oh, maybe I could think about this, and maybe I could think about this. Try and do it that way. I think that could be really helpful. Sorry, it's not very concrete advice, but yeah, I think that's all you can do. That's the best thing you can do, is just do that. Or you can even ask them again, oh, can you explain that a little bit? They probably won't be able to because they need to deliver the questions in a standardized way, but it might help. Hopefully it does. How would you advise preparing for literacy or numeracy tests? Yeah, I mean, it's difficult, isn't it? Because I think what they're trying to assess with using literacy and numeracy tests is your skill level, and it's a difficult thing to kind of practice. But I guess reading a little bit that would bring up some of your literacy maybe, or doing some kind of little brain teaser numeracy type things, maybe that will help. I'm not sure. In my experience, they haven't done lots of those on the interview. They might do deductive reasoning and those sorts of tests before, at the kind of application shortlisting stage, but I haven't noticed many of them around the interview stage, but they might be changing. So someone's asked whether I did do a master's, and yes, I did. I did do a master's at Newcastle University in Foundations in Clinical and Health Psychology, and that was mainly because I came out of my undergraduate degree from UWE Bristol in 2015, and I just felt that it was very theory driven, and I didn't really understand how it applied to practice. I also wasn't quite ready to enter the real world yet, so there were some other bits in there, but I do feel that my master's really helped me understand a little bit more about applying things to practice. So yes, that was definitely something I would recommend if you can. Obviously there are funding issues with it, so it's not something you need to do, I wouldn't say, and there are plenty of people in my cohort that don't have anything above a degree. So, does the scoring at interview take into account scoring from application? Nah, I don't think so. I really don't think so. It might do. It might do when they really come to, if you've got two candidates that scored equally on interview, they might then go to the scoring on the application. It depends. But I don't think routinely they would. Um, um, so, would you be allowed to take paper into the interview to take notes to help plan your answers, or does everything have to happen on the spot? Yeah, everything has to happen on the spot, really. You can make notes. Many of the interviews that I've had, they've said, here's some paper, or make sure you've got some paper so you can write notes. But yeah, you can't usually take stuff in. As I said, online you might be able to have some notes around, but I actually didn't find them helpful because the questions are designed so that they are hard to prepare for. They are designed so that they are testing like your skills and your knowledge and how you apply things. And if you haven't developed those things yet, that's okay. It just means you need to go and develop them. So yeah, I would say so. If I didn't do as well on research methods module in my undergrad, would that affect my application? Could do. Depends on the course. Some courses specify a certain percentage in your research methods. Some don't. So it really depends on the course. So what kind of literature would you recommend to read other than research papers? Yeah, I would definitely, I know this is a research paper, but have a look at a systematic review, meta-analysis, the most recent one of those on a particular topic that you're interested in or that you've worked in. That would be good. Also, I would think about the NICE guidelines for particular conditions or things that you've worked with. Definitely think about that. Or if you're in Wales, think about the matrices, because that's kind of equivalent. And same with Scotland as well. They'll have their version of that. So I would definitely think about the NICE guidelines. Also, some of the BPS stuff. So BPS guidelines for trainees, and also some guidelines for, I don't know, like working online, lots of different things that they have. Have a look on their website, the Clinical Division of Clinical Psychology at the British Psychological Society, BPS. Have a look on there because they will be lots of different things. But again, be focused with your reading. If there's something that you don't know about, maybe have a look, but think about where it fits. You're not going to be able to remember all of this stuff. You're just not. Okay, coming towards the end now, guys. Pop in any last questions that you've got and I'll try and go through them. Lastly, third to last even, in what ways might you be able to demonstrate the importance of service user involvement in practice and research? Yeah, so I mean, what's your perspective on service user involvement firstly? Why do you think it's helpful? Have you had any experience where it's helpful? Have you noticed it? Has your service done any service user involvement and how did it help? Why was it helpful? I would think about that. I would also, maybe you could try and find some papers that show that research is more impactful or more applicable to practice if you have service user involvement. You could find some studies that show that service user involvement is really valued by both researcher and service user. Maybe find some research around it. You could think about that, but also I'd think about what your perspective is, and really try and make it personal. Penultimately, we have any tips for preparing for clinical questions for someone with a research background. For example, haven't ever directly delivered interventions or written clinical letters, so all hypothetical. Any good examples? Yeah, that's an interesting one. I think it's difficult because I think a lot of the courses really do want that clinical experience. But if you've got an interview and you only have research experience, then that's useful too. And it depends on what that research experience is. Were you conducting interviews? Were you delivering questionnaires? Were you doing data analysis? Like if you were having any kind of contact with people, then that can count as clinical work as well in a way, like it, because you're having that kind of contact. I would think about what you would actually do. Yeah, so make it hypothetical. Like, what would you actually do in that situation? Really think about some different clinical situations that could come up. Like someone telling you that there's a risk issue, that there's a safeguarding issue, someone being aggressive, a team member disagreeing with you, privately or kind of in public in a meeting. I don't know. Think about lots of different situations that might come up in clinical practice, and then think about, well, what would I do? How would I manage that? So hopefully there are some examples. And how to use the what, so what, now what for positive things. Cases that went well, as most reflective models seem focused on an issue or a difficulty. That's a really good point. Yeah, lots of them are. Actually, so yeah, I mean, you can still use what, so what, now what for something that went really well. So, for example, it could be, I'm really focused on risk and safeguarding today. I'm sorry, it's been that sort of week. So it could be, they ask, I don't know, they might give you a vignette of someone coming to you saying that there's a safeguarding concern, like a child is being neglected, for example. A team member comes to you and says that a child's being neglected. What sorts of experiences have you got that might be able to address that moving forwards? And it might be that you say something like, well, what happened? So what is a client came to me, and it was a very similar situation. There was a safeguarding risk developed, and you might be able to explain a little bit more about that, obviously protecting confidentiality. So what did you do about it? So what I did is I explained to them that I'm a bit concerned. I'd go to my supervisor, I'd talk it through, and we'd make a good plan. I'd talk to the safeguarding nurses, I might make a safeguarding alert, and this is what I would do. And now what? Then you think, actually, I was really pleased with how I handled that situation, and it helped me get confidence in myself, and it helped me feel empowered, and it also helped me realize what my level of competence was, because it was tested. So that you can think about it that way, it kind of gives a bit of a positive frame of mind. And I think what now what is a very good tool for those positive things as well. We've had a couple more questions come in. So when designing a research study in interview, does it have to be experimental with a control group? Are relationship studies okay? For example, regression analysis? Yeah, usually they will be okay. It depends on the question. And it might be that they ask you to design a study that tests something. It might be that they ask you to predict something, in which case a regression would be appropriate. And yeah, it doesn't have to be experimental. I think in my interview, when we were asked to do something like that, I said mixed methods, and my course is quite quantitative, but I said mixed methods anyway, because that's something I value. I really like qualitative work. And that's obviously not, I don't think I really did have an experimental element to that, actually. So yeah, I don't think you need to. It depends on the course, depends on what they like, and it depends on the question. So hopefully that helps. What would they be looking for when asking about our childhood experiences? Yeah, so none of the courses I've interviewed for have asked this. Lots of them do. There are some that really ask about it. I would say that they are looking for how you set boundaries, how you talk about the things that you find difficult, or things that you find helpful, like how do you communicate that information. I think those are the sorts of things that they're looking at. And also how you manage being asked about that, because clients will ask you, patients will ask you that. They will ask you, well, have you ever lived with chronic pain? Or, and you have to kind of be like, oh, well, yes or no, or like, how do you handle that? So I think there's a few different elements that they're looking for in that, if that helps. I hope it does. I hope that I have covered all of your questions, and please do, if there's any other questions, please make sure that you put them in the comments, and I will always reply to any comment that I get. So please make sure that you do. I will make sure that there are all the helpful resources that I've mentioned down in the description when I upload this version to YouTube, so they'll all be there for you. But just to summarize at the end, guys, congratulations if you have an interview, and if you don't, it's okay. It is coming. It's a numbers game. Be focused with your preparation and don't over-prepare. Really think about what the course wants, what they value, and try and do your reading and preparation around that. Breathe, smile, use your anxiety management techniques, and drink water. And remember, you can't know everything. If you don't know something, just tell them. Just tell them that you don't know. And then think about other things from your knowledge and experience that can apply. And reward yourself afterwards. Regardless of the outcome, regardless of how you thought it went, it was a big thing. So make sure you reward yourself. And if you're not successful, as I said, remember it's a numbers game. It's not a reflection on your worth as a person, your suitability for training. It's not. It's actually not. Like, sometimes it will be. You're not ready for it. That's okay. It's not about your worth as a person. But it is a numbers game. Remember that. It's the system that is flawed. 95% of candidates for my course did not get a place. It does not mean that they are not good enough. And the feedback is valuable usually, so make sure that you try and listen. Thank you all so much for watching. I really, really appreciate it. And I really hope that this has been somewhat helpful for you. And I know we've gone through it at a rate of knots, but well done for listening. I'm so grateful to you all. Make sure that you like and subscribe on YouTube and on Instagram as well. And hopefully we will see you at another time. Thank you so